I'm Dr. Nick Gideons. I'm a medical doctor. I'm associate professor of family medicine at Oregon Health and Science University.
And what is a doctor's responsibility to offer comfort care? Does that vary state by state?
Yes, and there's a variety of factors that will impact that, like various board findings in your individual state or laws. But generally, we have the duty to relieve suffering when able.
Is there anything more you can say about that?
There are certainly constraints on using medications that can have bad side effects or unintended consequences. For example, we have very specific federal regulation around using opiates for pain relief. Balancing those interests is always an individual decision with a physician and a patient. But again, we have in general principles, we have the duty to do the least harm possible, the do no harm, first do no harm, and the duty to relieve suffering.
What is medical aid in dying? Can you explain that, please?
Is whereas a prescription is specifically written to end suffering, where it's going to be a lethal dose of medication that the patient will self-administer or self-ingest. These laws vary somewhat by state to state, and the general trend is to relax restrictions. But generally, there's some need for repetitive request, maybe a waiting period. The patient absolutely needs to have a terminal illness already. In other words, they are already dying. And to be autonomous in their decision-making and competent in their decision-making, fully understanding the risks and benefits of using medicine in this way to relieve suffering with a physician's order. One of the great advantages we've seen in states with this law is a decrease in suicide rates among patients who are in palliative or terminal care, for example, or complex situations where physicians, it's unclear what their intent has been.
I'm local for you in Columbus, Cynthia Rossi on NBC4i.com.